I will be going over the medication Eliquis or Apixaban. This is my patient, Nathan, and we'll be going over Eliquis together.
Hello.
Are you familiar with what Eliquis is used for?
No, I am not.
Eliquis is a blood thinner that can prevent and treat dangerous blood clots. It prevents these clots by blocking a clotting protein called factor XA. Let's go over the adverse reactions we wouldn't expect with Eliquis.
Okay, what should I be on the lookout for?
You should watch for signs of sudden bleeding or bleeding from your bladder or during bowel movements. One way to check for bleeding in your stools is if they look black or tarry.
Okay, I'll be sure to track if I notice a black color in my stool.
Great, how about we go over the instructions for Eliquis? This medication should be taken as prescribed and not stopped suddenly. You can take this medication by mouth, with or without food, or crush with apple juice or water. You might notice more bruising. If you do notice bleeding that won't stop, rashes, or signs of an allergic reaction like swelling of your face, shortness of breath, or dizziness, you should contact your provider.
Okay, I shave every day. Is there a way for me to prevent bleeding?
One way to prevent bleeding while shaving is using an electric razor instead of a disposable razor. You might also notice bleeding in your gums, which can be prevented by using a soft bristle toothbrush.
I guess I'll have to go to the store after this then.
I guess so. Thank you, Nathan. This concludes our interview. As the nurse, I'd verify your prescription and dosage with the second nurse since this is a high alert medication. I'd monitor for any signs of a DVT, stroke, or PE. I'd also assess for any signs of bleeding. Eliquis can be administered by mouth and does not have to be taken with food. It can be crushed and mixed with liquids. This medication is contraindicated for patients who are severely bleeding, may be pregnant or breastfeeding, or patients that have severe liver damage, as well as patients with prosthetic heart valves or a pulmonary embolism with hemodynamic instability. This medication requires precaution for pediatric patients, as well as patients with renal impairment or patients with a history of spinal deformity. You should also use caution in patients over 80 years old. Medications like phenytoin, carbamazepine, and rifampin will decrease the effect of Eliquis. Ritonavir, ketoconazole, itraconazole will also increase the effect of this medication. Heparin, aspirin, and NSAIDs will actually increase the risk of bleeding if taken with Eliquis. A helpful nursing mnemonic for Apixaban, with this medication being a factor XA inhibitor, is X marks the spot. Apixaban is an anticoagulant directly targeting blood clots.